Well, good afternoon, everyone, and welcome to our webinar today. I am really excited to be able to be here with all of you this afternoon, and also very excited about some guests that we'll have coming on to our webinar here in just a few minutes. So we do have our welcome slide up and want to make sure everybody's in the right spot. This is our webinar on forming and strengthening relationships, how pediatricians can play a key role in childcare. And just so that you know, we do have all of our attendees muted in the background, but we will be taking questions throughout and incorporating them into our presentation. So if you do have a question, you can ask it into the question bar on your right. Also important to note though, if you did ask a question when you registered, we've already got those questions. So you don't need to ask the same one again. We've already been able to incorporate them. Excuse me just a second while I get my screen moving around. All right. Well, I'll say again, welcome to all of you who are able to join us today. My name is Natalie Brake, and I am with Early Learning Indiana. I have likely met many of you as I've been trying to increase the number of our individual early learning providers around the state that I know. But I'm really excited that you are able to take some time from your day to join us today because this is such a crucial and important topic that we're discussing. So, really, throughout the COVID-19 pandemic, we've been hearing from partners and providers that a top concern is the impact of COVID-19 on the physical and mental health and well being of your staff and the children and the families that you serve. Because it is such a crucial issue and because there are so many questions around it, we have come together, Early Learning Indiana, in partnership with the Indiana chapter of the American Academy of Pediatrics and the Office of Early Childhood and Out of School Learning through FSSA to bring you this three-part webinar series addressing these topics. So I must give a shout out to our partners, as I mentioned, that Indiana chapter of the American Academy of Pediatrics and the Office of Early Childhood and Out of School Learning. It's been a real privilege the past few weeks to work with them and to bring these topics and these ideas to light and to be able to have them come alongside Early Learning Indiana in order to really put the topic out there and answer a lot of questions that we know providers and others invested in early childhood education around the state have right now about how best to support everyone. As I mentioned, this is part of a three-part series. So today is webinar 1, and then in 2 weeks, on Tuesday, October 13th, we'll have webinar 2. And 2 weeks after that, we'll have webinar 3 on Tuesday, October 27th. You'll note the topics for these 2 webinars are all related to that health and well-being, but each of these 3 webinars have a little bit of a different turn on it. So today what we're looking to really address are the ideas of how we can better partner together between pediatricians and early learning providers. The upcoming webinars focus in on a little bit different aspects of that health and well-being. The next webinar, the Maintaining Physical Health During Flu Season and the Pandemic, is focusing in really on the physical health of children in your care, what you can do for the children, your staff, and your families. And the third webinar is looking at recognizing and responding to heightened stress levels. And that includes heightened stress levels with your staff, your children, and your families, and how you can include in and work with some of that family engagement and how a pediatrician partner can help you navigate some of those pieces. I want to point out now that we got so many questions when we were doing our registrations for today's session, and many of the questions actually fit a little bit better in one of our other 2 sessions. So if you did ask a question when you registered that does not get answered today, I would highly encourage that you join us for our next 2 webinars and that your question may be answered within that, because we do have many questions that related directly to the physical health or related directly to responding to stress. So as we go through this, remind everybody that you can ask those questions, but that we also did get questions as we started, and we will be very happy and excited to answer as many as possible, knowing that we cannot get to all of the questions that were possibly asked just because there were so many of them. And so we'll continue to share out resources after this as well and look at what we're doing. Okay, so the topic at hand today is really looking at how can we form and strengthen those relationships between pediatricians and early childcare providers, knowing that both are two sets of adults that are highly, highly invested in the healthy development and the healthy well-being of our earliest learners in our community. Also, knowing that these are two groups of people who have dedicated their careers to serving our youngest children and their families. People who go through the process to become a pediatrician, and those who go through the processes to become our early learning providers are dedicated to their crafts. They are dedicated to serving their families and the children and meeting the needs of our early learners across Indiana. So, what can this look like? What types of relationships could they look like? How can we support each other? And how can we interact with each other? When we asked for registrants to send us questions, we realized that they fell a lot in about four different categories that we're going to engage our pediatrician guest to answer. I will also be monitoring the question bar to see if there's any other questions that we can put in here. And to let you know just a little bit more about the format before we get into it a little bit further, I will have my guests join us because they are going to be giving us their expert answers and engaging throughout these questions. I'm going to be asking the questions as we go, but also that we may not get to every single question just because there are so many. And we've prepared some resources that are on the slides we'll click through. And these resources were specifically prepared because they answer a lot of the questions that we received as people were registering. But if we click through them in a little bit of an order because I assumed we may answer them this way, we might not. I might click back and forth, but we will have these slides available as a PDF afterwards for those of you who want to view them more. So you don't have to hurry to click your screen and try to get a screenshot. You can always visit our Early Learning Indiana website later and we'll make sure that it's up there for you. So at this point, I'd like to go ahead and invite our three guests on. If you are able to, we'll let them get a chance to click on so that you're able to see them as well. And this is always the fun part where we see if we can all click on and what it looks like. And we may not get Dr. Scherer because her computer did not want to cooperate with us, and such is the way of technology. I don't know about all of you, but earlier, about an hour ago, I was telling a group that I was meeting with that today was the most Monday-ist Tuesday that I have had in a long time. And it definitely felt like a bunch of the contacts that I had this morning and questions were supposed to come on a Monday and they just got lost and delayed and showed up on a Tuesday. So if we are not able to have Dr. Scherer join us via camera, we will still have her join us via sound and she'll be able to answer some of the questions. So I am very excited and honored to be able to welcome to our webinar three guests that we have who are joining us here. We have Dr. Scherer who's joining us, we have Dr. Sweck who's joining us, and we have Dr. Swagonski. I have to say, because I said it to them too, we did not plan it to where we had three Dr. S's. It just ended up that way. I actually say that not knowing if any of you go by Dr. S, but knowing that as I had kids and interacted with kids, my name quickly went from being Natalie Brake to being Mrs. B. There might be a likelihood you guys get called Dr. S at some point. So we will make sure to differentiate between all of you and be able to ask questions that way. All right. So we are going to dive in, and this is what we're going to do. We're going to go through some of the questions that were asked ahead of time. As it makes sense to, I'll look at the questions and see if I can put any of the other ones in here. I do know that there are several people who are also still working on if you have any sound issues. If you try to, keep going through and we'll see what we can get to. Okay, so when we asked out the questions to participants as you were looking to register, we also asked a couple of questions of center directors and teachers that we know of all various types of childcare. Looking at these topics of how can we partner, what can we learn on, how can we better work together as two groups of people invested in early learners. One of the first areas that came up was around general development. So looking at general development of what we're looking at for children is, what healthy development looks like, what healthy development doesn't look like, really where we can see if we're concerned, where we can jump out at. So I'm going to start with our first set of questions around general development for early learners. And for my doctor guest, if you need me to click through, I have a bunch of the resources you shared with me, and I'll click through them as best I can. But we'll also, again, share all of these out afterwards so that way we can have it. So the first question that we had was around, what do pediatricians typically screen for? So do pediatricians specifically screen for developmental delays when you have children coming in for those well-child visits? And then what can those providers do when they're concerned about a child's development?
Hey, good afternoon. This is Dr. Emily Shear. I apologize that you cannot see me, but hopefully you can hear me okay. I'll take a first stab at this. And so, yes, we do screen for development at certain visits. We observe and survey development at most of our visits, but we do formal screening at the AAP recommended ages of 9, 18, and 30 months old, as well as any time that a parent expresses concern about a child's development. And that could include a parent expressing that a child care provider or an early learning staff member has expressed concern to the parent about the development, and that could prompt us to further evaluate. And so one of the nice resources that I use with families are the Learn the Signs, Act Early materials from the CDC. And so with those, they have a website from the Centers for Disease Control, and you're seeing it here on the screen. And you'll notice on the bottom left where the red circle is, there's an entire tab for early childhood education, where you can find out how you might be able to incorporate these materials as an early care provider. And with that, it reinforces the same messages that the pediatrician or healthcare provider may be sharing with the family. These materials can include checklists about normal development where the parent can see how the child is doing. And these can also be used in a child care setting so that during your interactions with the child, you can see if the child is on track for the things that they're currently doing. They also offer an app that parents can use. I like encouraging families to download the app because I find that many parents like using apps for various things. They're often on their phone during the visit, and I have to remind them to please turn the phone off during the visit. So I know they're on them often. But with the app, there are videos and examples of ways that they can play with their children to foster development. And one thing that may be nice, especially as we think of partnering together, there's a section in the app where they can include concerns that they have so that when they're at the visit, they can pull up that app and share the concerns they had. And if you express concerns to the parent, they could make notes in that app, because sometimes it's hard to remember during the appointment, during the 15 minutes I have with the family, for them to remember exactly what they wanted to talk about during that visit. And so if you've encouraged them to make a note there, it may help for that to come up during our time together.
I have to say, I love hearing that right there, just one of meeting parents where they are. And as somebody who does not currently have an early learner, but has two in elementary school, I have to be reminded of the fact that I need to put my phone away when I am at our pediatrician's office as well. So I like being able to use what parents are familiar with in order to build on how they can interact. Excellent.
I just wanted to mention, I think most early childhood educators know this, but just a reminder that a child's brain is rapidly growing. In fact, by the time you're 2 years old, the size of your brain is 85% of the adult size. And so what happens after that is really pruning and strengthening of the pathways between the neurons. And so what happens in reality is what you gets used gets stronger, and what isn't used goes away. And if you think about that in terms of development, the more words you hear, the more language and stronger those pathways get. It's also true, though, about social emotional control, right? So as you learn better and better to control your emotions over time, then those pathways get stronger too. And one of the things the CDC talks a lot about is supportive, structured, nurturing relationships. And when I think of that, the first thing I think about is early childhood educators.
Mm-hmm.
So I just want to say that I think that pediatricians are huge fans of all of you, that we really do thank you for the work and the support that you give to children. We really think it's really important, and probably like a lot of professions that deal with children, we never see the long-term impact, but in fact, the impact that you're having on that developing brain lasts a whole lifetime. So these kinds of developmental things, although we can screen for them, the reality is I think that you are the instrument that helps make those changes. So again, thank you for your work.
Dr. Sogansky, I have to love that you said that. And I'll say at Early Learning Indiana, we like our early learning providers across the state a lot too. So we're very excited to be able to see them. I know that there's a couple other resources on here, so I do want to click through so that you guys can see them that are directly related to that same question about healthy development and what to do when things are on track. When we looked at the questions that were asked, we got so many suggestions and so many thoughts that came from our pediatrician guest here, or Dr. Guest, that we had. I don't know if there's any others that you guys would like to highlight, or if you want me to move on to the next question.
I just briefly wanted to echo Dr. Schur and Dr. Sogansky to thank our early learning or early childhood educators for your work day in and day out. And as Natalie was saying at the beginning, we really do share a common purpose as pediatricians and early childhood educators in creating supportive, nurturing relationships and environments in the home and outside the home for our children to live in. And so there is, just wanted to show you, there is one program that supports healthy development that a lot of our clinics do have called Reach Out and Read. And that is where we give a new book at the beginning of a well child visit from birth through age 5, and just encourage families to read together every day as a fun, healthy routine, as a way to not only get their children ready for school, but also to create those loving, supportive relationships and really build that socio-emotional learning and development. So there are some resources there to share, particularly just to kind of let you know that when you incorporate story times and healthy routines around books into your everyday learning opportunities for children in your centers, you're really reinforcing the messaging that we're giving our families, that just reading aloud every day is such a healthy part of a routine. So there are some resources that we'll have available to you that also highlight how shared reading every day can not only help your child's language development and their social emotional development, but also as a great way for families to help deal with the stresses that they're encountering right now around COVID.
Excellent. Well, and that leads directly towards our next question. I'm going to click through the next couple of slides that have some additional resources on development, and we'll remind everybody these slides will be available after this webinar. So if you do have any other questions or thoughts around development, these here for resources for first steps, in-source, and all those other pieces will also be available. But since you said that, that does link directly to another one of our questions that we had come in, which is really about how do pediatricians help parents feel comfortable in sending children to school and to early learning care right now? One, just in general, due to development, but then really specifically right now to COVID. What are you guys seeing, and how are pediatricians having these conversations?
I can start off that conversation. We have right now highlighted, and I know that many of our early childhood education providers are familiar with First Steps and In-Source, just reassuring families that if they do have some developmental concerns for their child, that these two organizations are tremendously helpful, and they're ones that as pediatricians we refer families to as well. First Steps being really kind of the early intervention providers for children birth through 3. And then once those children then become or turn 3 and above, then in-source can be another resource for families, especially in navigating the school system and learning more about what an IEP or individualized education plan is. So these are 2 resources that we rely on to help support families in that journey when their child has some developmental concerns or really benefits from additional developmental supports.
And I think that's a really big one when parents are concerned about sending to care in general and the development of a child, what that can look like and how that support can be given across the board from both the pediatrician side and the provider side to ultimately help those parents feel like they can make the right choices. So I want to get to the other part of that question was more specifically around, there was the in general going to development and pieces, but specific to COVID. And I'm going to go ahead and go to the next slide because I think this one really hits on a lot of the pieces when you do have families that are concerned about sending to care currently because of the situations with COVID and see whoever it is who would be the best to kind of address how can pediatricians reassure families or help them understand what's going on right now when it comes to COVID.
Yeah, I'd be happy to talk about this. So one of the things that I think is important is there's a lot of misconceptions around COVID. And so to me, one of the things that is helpful is to remind parents that the virus is not in and of itself a living organism. It's an RNA or protein molecule that's covered by a protective layer of lipid or fat or grease. And basically, it has to get in contact with a living cell in order to do any damage, right? And so that usually goes in via the eyes or nose or mouth. But the other thing is that it's very fragile. So the reality is if we get rid of that protective layer of fat or lipid, then the virus can do no damage. And so it's one of the reasons that we talk about wash your hands, wash your hands, wash your hands. And it really is not that you are to a certain extent, but washing away the virus or germ. But you literally, by getting the lather of the soap, are breaking down that protective layer of fat so that protein is exposed and it can't do anything. Right? So you all know probably more than I do how to get kids to wash for that 20 seconds and really get the lather up. And generally, because it is a fat layer of grease, we want warm water, right? The other thing is again, heat melts fat or grease. And so whenever you wash clothes or anything else, using hot water is helpful. Alcohol dissolves grease. So using the alcohol, everybody knows, greater than 65%. Any mixture of bleach, that's 1 part bleach and 5 parts water. So I know you all in childcare have a whole list of like EPA approved ingredients that you can wash with. But I think for parents, giving them these very simplistic ideas of, yes, plain soap really does do the trick is very helpful. The other thing is antibiotics are not, right? It's not a bacteria, it's a virus, so that's not going to help it. There's some other just common sense things, like if you have a kid at home or within your setting that has been coughed and sneezed or has a runny nose, you don't ever want to shake things out because it basically scatters the virus, and then it can get in through the air, through your nose and stuff. The other thing is a virus can't go through healthy skin. So if your hands don't have cuts or cracks in them, you cannot get infected at all. So with us washing our hands multiple times a day or using alcohol, you should, in fact, make sure that you're using a moisturizer so your hands don't get cracked. And keep your nails short because the virus can hide underneath your nails. And when you lather up, be sure to wash your nails. So these are kind of common sense things that when parents ask me, I think are sort of reassuring. You guys can tell me whether you use similar sorts of ideas and information for parents as well. And then we can go to the next slide, which is really a study that came out last month I thought it
Oh,
was the next.
and I think
Okay, this is a
Dr.
great
Skwatski,
resource.
yes, I missed getting the studies attached here, but there are two great studies that Dr. Skwatski can reference that we can share out afterwards as well.
Okay, I can just briefly talk about it. Basically, the MMWR, so it's the publication by the Centers for Disease Control about 3 weeks ago, published something about 666 childcare sites in Rhode Island that were open and looked at transmission within the childcare sites. And what really turned out to be interesting is that even though people in the childcare sites had COVID, right, and the rest of Rhode Island also had COVID, that increase was parallel. So there wasn't more COVID than what you might expect compared to the general population. But within the 4 sites, there were maybe, out of the 666 sites, there were maybe 4 sites that had transmission within the child care site, the sites themselves. And when you really looked at the data, it was probably only 1. Well, only 1. The others had problems where they weren't following the recommendations, using the cleaning schedules, wearing masks, or doing other things. So I think that it was very reassuring, at least to me, to say if we use common sense and do these right things that are recommended, that we can do this safely.
I think that's such a big point that you make there is doing the precautions. And I wanted to make sure to hit, I mean, what you guys shared with us and what came around. And I love seeing this. This was suggested by providers as an option to look at in a resource. This was suggested by our partners at the INAAP and at FSSA through the Office of Early Childhood Out of School Learning. But the Let's Get Back to Work campaign that is out right now to support providers in communicating to families about the importance right now. Some of them are on the screen. I'm going to flip to the next one, which has a couple of the other pieces, but they're resources for providers to use around these topics. So it's wonderful to hear that parents are getting the same message from the providers that they're getting from the pediatricians, but really looking at hearing those studies and hearing that, you know, when you take the precautions, you're able to offer high quality care and in a safe way. And that's really what it comes down to. Well, speaking of offering care in a safe way, one of the questions we got in multiple ways was looking at finding guidance or recommendations for safety. And so how do providers know what they should be doing and how they can ensure that they are having a safe space for their children and their families as they come in? So I'm going to shift to our next slide that has a couple of resources that were shared with us to really address what resources or what guidance or recommendations for safety are out there for providers. So looking at these for our providers, these are probably ones that you may have already heard of, but if you have not, when we look at resources like iLead and Spark, if you have not clicked through the FSSA fact sheets, I started clicking on them and then made myself stop because there are so many on multiple topics, and I told myself I had to get back to work. But when I was looking at them, they're very easy to take a piece, take a topic and dive into, and then definitely safe sleep or other additional needs. So would like to make sure that everybody is aware that when it comes to recommendations or guidance, that you would want to be going to the FSSA childcare website in order to get that information. And also going to put a plug out, as you may be aware, the Office of Early Childhood and Out of School Learning has updated periodically their recommendations when it comes to current safety practice due to COVID-19, and there should be another update about that coming out this week. So look for that to be promoted and shared out.
Right, and I mean, everybody on here knows that to get licensed, the first category that you have to do is health and safety. So the one thing that I wanted to mention, and I know you guys do this, is safe sleep. So just a reminder that we have a way too high of infant mortality here in Indiana. We're the 6th worst state in the nation. When we look at our infant mortality, Black infant mortality is 2 to 3 times higher than whites, and much of that is due to sleep practices or unsafe sleep. 1 out of 6 babies that dies related to unsafe sleep. So one of the things, again, that we think of with childcare providers is what great role models that you are for parents, right? And if they have a child who comes into your child care, I mean, as they enter your child care, one of the things you're going to talk about is, so, you know, how does your baby sleep? What do they eat? You're going to get all the information. What do they like to do? And if you hear things that aren't safe sleep, you're still going to have to practice safe sleep. We know that. But you could then have the conversation with the parents about, well, you know, by law, we have to practice safe sleep here. And I would like to help you build habits with your child to work on making sure they are as safe as possible, both here and at home. So I know here in Marion County, we are working with several child cares to actually provide safe sleep kits that has a sleep sack in it, a pacifier, the Sleep Baby Safe and Snug book, and they use it as a welcome kit to their new families of infants. So give it to them as a gift, again saying we practice safe sleep. In Marion County, and I'm sorry that we don't have this everywhere. Actually, it is in Allen County too, because we work up there. But if you need safe sleep materials in your child care, then you can get a referral from your licensing coach, and we usually are able to provide you with safe sleep materials, meaning a sleep sack, sometimes even mattresses or even replacement cribs. So I'm sorry it's limited just in Marion and Allen County, but that's what our funding is.
I do think there's an important component there as you make connections either with local pediatricians or also you make connections with other community partners, seeing if there are initiatives that will support safe sleep practices with your families or within your program that you can have come on.
If I can, I just wanted to have one common question that comes up to me from parents and grandparents is that they're worried that putting their baby on their back is going to make them at risk if they do spit up, of the spit up going down into their lungs and aspirating. And thankfully, we have a nice visual aid through a lot of these safe sleep resources that actually shows that putting a baby on their back is the safest way to actually prevent aspiration and any spit up from going down the wrong way into the lungs. So that's just a common question that I get over and over every day. So just wanted to pass that on. I know many of you already know that, but you can just, again, reassure them that anatomically it's safest to have them on their back in terms of preventing any complications like that.
And one of the things I think that you brought to mind when you actually said that there, and we'll be talking about towards the end when we look at partnerships and what it could look like to have a local partner, it does help to have the pediatricians and the providers saying the same thing to families in the same way. And it all comes back to the science of it and what's the healthiest best practice for our children. So having that component and being able to reiterate and reassure with the same information really does make it common information then. And it can become much more prevalent and much more supported within your community because you have the experts on both sides saying the same story in the same way. We are going to dive into an incredibly important topic in just a second here. I want to point out we did have a question about health screenings and lead poisoning. So we did include a resource about this, and this will be in the pieces that come out. But I want to get into this next topic because about a third of the questions that we had come in were related to it. And this is the fun topic that I'm sure comes up on both sides of immunizations. So I'm going to go ahead and go to our first slide on immunizations that we have as a resource. But the first question that comes up is really about staff and adult immunizations. So what type of immunizations should staff be having yearly? And should flu shots be mandatory for all staff? Who would want to take a crack at adult immunization questions?
I'm willing to start talking about this. This is Dr. Emily Shear. So it does depend a bit on the age of the staff member, and that's why if you're looking at this chart across the top, you can see the age. And so for younger staff members, it would be an annual flu shot, and we've just started the new season of flu shots. So even if you had a flu shot in the early months of 2020, if you got your flu shot in January or February, it's time for another flu shot. So you can be encouraging staff now to get a flu shot. And then we want to make sure that they are up to date on their tetanus, diphtheria, and pertussis. That pertussis is whooping cough, and especially for those who are taking care of young infants, but really all young children, we want them protected against pertussis and whooping cough, because we don't want, especially our young babies who wouldn't be vaccinated against it yet, to be getting that illness. Then they also should have measles, mumps, rubella, as well as varicella, which is chickenpox. So those are the ones that you're going to want your younger staff to have. Once we get into some of the older ages, there may be additional vaccines recommended, such as zoster, which is the shingles vaccine. And I think the next slide may include resources, because you may have concerns about where your staff, okay, so it's not on here, but it'll be maybe on this one, that you may have questions about where your staff could get those vaccines if they aren't fully vaccinated. If they have health insurance, their health insurance will likely cover it, and they can talk to their doctor's office, or retail pharmacies will often also offer immunizations. But if you have staff who are not insured and don't have health insurance, or the insurance they have doesn't cover vaccines, there are state-funded, adult publicly funded immunizations, and we've put a link here for where you can find that, and that's statewide. Some of those are at federally qualified health centers, others are through county health departments. There's a variety of places that they can go for those. So I would encourage you to share that as needed with your staff.
So I have to confess that when this topic came up, and our doctors present can also attest to it, I had a moment where I paused in our discussion and said, I have never once, as a parent, thought about whether or not the staff that are interacting with my children are up to date on their immunizations. I think it was just an assumption. I worried about my children getting theirs, and I worried about mine and those aspects of it, but it makes me want to know now about the adults that are interacting with them. And I think it's such a great opportunity for our early learning providers to showcase that to their families of, here's what our practices are, here's what we support, and here's how we ensure that our staff are healthy when they're interacting with your kids. So it was an eye-opening moment for me as a parent, and I bet it will be for many of your parents as well. So along with that, we had the questions about what types of immunizations should children get. And there is one resource that I know that was on here, that was shared a little bit about who gets what when and what that looks like. And directly related to this, as we look at who gets what when, as we talk about that, comes up the question about how can early learning providers engage with those families who see this recommendation and see these pieces and do not agree with vaccinating their children? What are some of the risks, and how can we share some of that factual information with them?
So Dr. Sweck, do you want to talk about the first part, and I'll talk about the second part of that question?
Sure. So the first was just what are recommended there. So that is the CDC recommended immunization schedule. And this schedule really has the most evidence and research behind it. And there is a lot of evidence-based rationale in terms of recommending vaccines at certain times of life, because the body is just more able to mount the best response and protection against that disease. So as pediatricians, we really do recommend the CDC approved schedule as being the most effective in protecting children from these life-threatening diseases. Was there any more to the first part before?
That was the biggest part of the first part. The second part is where it gets a little bit more complicated.
Okay.
And I'm going to click all the way through here to how do we address these families who don't agree with it, and how can we be consistent and factual with our information?
So first, I have to say, I wish that I had a real evidence-based answer for this. And the reality is people have tried a lot of different things. We know that there's real reasons why parents refuse vaccines, right? They want what's best for their kids. And if they're worried about vaccine safety or the necessity of them, or some of them freedom of choice, those are kind of the three big reasons why they have what we call vaccine hesitancy. And one of the things that we know is there's some parents who have what we call the vaccine hesitancy. So they just need a little more information, a little more talking with, and there's some that are vaccine resistant. And the ones who are resistant, one of the things that we know about research is if you start to argue actually with either groups, the reality is they will dig in their heels even further. So just, being adamant about it is not going to work, right? So what you have to really pull back and have a conversation about their concerns. The other thing is there's a lot of this information deficit model is what they call them. Oh, if we just gave them more information, they would make that choice. And we know that honestly, that doesn't work all that well. Right? You give them information, but they have information that they've gotten from wherever that they believe and they believe strongly. So what does seem to work? Well, one thing is, we use social stories in children a lot. Well, social stories actually work for adults too. And so social norms, social stories, I always share, I'm old enough, I've seen people die from these childhood illness. I've seen children die from chickenpox. I really have. I've seen children die from Haemophilus influenza. It isn't that long ago that these diseases were prevalent and in fact killed our children. So I tell them just flat out, one of the reasons I'm such a huge fan is because I've seen children die, and I'm not lying. I also tell them, and this is the honest truth as well, is because I had seen children die of Haemophilus influenza, my oldest son was one of the experimented kids to get the first vaccines for Haemophilus influenza. I felt so strongly about the benefit and potential benefit to not only him, but to other kids. Other people use other kinds of social stories and social norms. And in childcare, I think one of the things that you could do is to say, 95% of our children are fully immunized. And those 5% who don't have their children fully immunized are bucking the norm. I think it's also important that when there are children or even adults who have different kinds of immunocompromising situations, right? You may have a child care provider who has lupus or something like that is on chronic steroids. You don't need to give the specifics of the disease, but you could even let them know we think immunizations are so important, not only to protect your child, other children, but also our staff members, because some of them are taking medications that make them immunocompromised. So one of the reasons that people will get immunized or get their children immunized is altruism, right? They sometimes do it for other people. And I saw the last thing I'll say is I just saw, going along with social norms, I saw a really cute picture of a little boy at Disney World after they had that outbreak of measles there. And his t-shirt said, "I am fully immunized. You're welcome." And I loved that t-shirt. So again, there's no absolutely right or wrong way. Certainly arguing isn't going to help. Think of the stories that you can share.
I think that's such valuable advice. And when I look at, it's all about reciprocal relations. I mean, everything comes back down to the relationships between the providers and the children you care for. And we know that that's such an important component, but to see that supported, and it is a two-way piece. I mean, when we care for infants, we have physical contact with infants and they have physical contact with us. It goes back and forth. And, the same way as our children get older, but that physical contact does mean that there's a risk then. And so how do we protect each other and what does that look like?
And along the lines of the community protectionist, Dr. Sukansky was just saying that we're really being urged by our pediatric infectious disease experts that it's very important that everyone get their flu shot this year, just because we are in the first fall and winter of COVID. And so that's in another one of our resource slides, but every infant aged 6 months and above really should get their flu vaccine. And that's not only to protect that individual, but their family and the community as a whole.
And when you think about it, when, who do families listen to? They listen to people that they trust. And one of my favorite sayings that she said I could steal, but for those from Allen County, you all know Deb McMahon, who was your Commissioner of Health for, I don't know, 25 years or something. But we're working with her up there, and she said, child care providers, trusted members of the family, essential members of the community. And I love that saying. I love that tagline. And again, I think you all have much more influence than probably you even give yourselves credit for.
I think that is so true. We do. I mean, early learning providers, you're in these families every day, in their caring and having the ability to do that. I would absolutely challenge everybody who is on right now to consider if you have gotten your flu shot. I signed up for mine through work yesterday and got my confirmation, so I'll be getting mine whatever day is in my calendar now. That's why I have a calendar for it. But if you have that available and look at that as a piece, and then if you are doing that through your work, share that with your families as to the reasoning that you're doing it for all of your employees and what they're looking at. That's a really big component, is telling the story of how you take care of your employees and why it's important.
And it'd be nice, I don't have that button, but it'd be nice to say, I am protecting your children. I got my flu shot.
Mm-hmm. Also nice to be able to show off your Band-Aid if you are with the preschool or pre-K and it matters what Band-Aid you have. My husband got his flu shot earlier this week, and he got it at work too, where there are no early learners, but bringing it home and showing our 8-year-old that he got a dinosaur Band-Aid was a hit in our house. So you can make it fun, you can make it interactive, and have it as a component of your family engagement too. Well, we have a few minutes left. I want to make sure that we hit on our 2 next topics that are really crucial and we got several questions about. So for one of our next topics, if I can get my mouse back, just want to pull it into individual family circumstances. And we got a lot of questions about individual family circumstances, and there are 2 we wanted to make sure to share some resources out about. Again, reminder to everybody, if we don't get to your question and it was one that you asked, we'll try to incorporate it into one of the other 2 webinars. But we want to talk on 2 specific circumstances, and then we're going to wrap it up in the last few minutes here about some partnership suggestions and what you can do. But the first individual family circumstance that was shared with us is, what options are there for families when you have families that don't have insurance? So I'm going to pull the slide up, and there's a couple of options that were shared with us, and I don't know if anybody wants to highlight any of them or just have them out here for them to see that there are options statewide and then locally that you can look at if you do have a family that doesn't have insurance. So I don't know if there's any of our guests want to highlight.
So children with special health care needs is for 21 different conditions, and you have to apply for Medicaid first. But if you can get that for many conditions, it actually covers the child up until age 21 for autism and cystic fibrosis. And Eskenazi and Health Net, we put those down. Those are Marion County federally qualified health centers, but there are federally qualified health centers throughout the state, and all of them do financial counseling and also have sliding scale fees. So if you don't qualify for a public health program, you can get a reduced fee for getting health care there. So any federally qualified health center. And then, of course, Medicaid in the federal marketplace.
Mm-hmm. And I'll just kind of follow up with that, with the sliding fee scales at the federally qualified health centers. You do not have to be a U.S. citizen to qualify for those. And so if you are caring for families that the children may or may not be citizens, or maybe the child was born here, but the parents were not and are not citizens, and therefore the parents may not qualify for some of the other publicly funded insurance options, they could still qualify for the reduced fee scale at a federally qualified health center.
That is a really important point, Dr. Shearer, and a good one to have clarified, because we do know that there are many providers who are serving families who are in a situation that would need that assistance. The other individual circumstance which came up in several of our questions and we wanted to address with the group is around what happens or how can a pediatrician support when there's a family that's experiencing homelessness? What does this look like for the family and how can we support as providers and pediatricians?
I can talk again. So there's several articles and policy statements by the American Academy of Pediatrics that talks about homeless children. And one of the things that we know for sure is that they have multiple significant health problems, including mental health, behavioral, academic issues, immunization delays, iron deficiency, anemia, poor growth, high rates of asthma, obesity, psychiatric and behavioral and developmental problems, disruption of their school attendance, and they oftentimes are exposed to multiple adverse childhood experience that many of you have heard about. So I wanted to basically highlight that we are obviously very concerned about these children. And one of the things, again, that we know that benefits children and is one of the most important things that you can do is have those safe, structured, nurturing relationships. And so again, childcare comes front and center as one of the most important things that we can have in terms of early childhood education for children who are with homeless families. You are an anchor for them. You are a developmental guide, and you can follow both their growth and help with nutrition. So we know these are issues. We have limited resources in Indiana, I think, for families who are homeless. We have many families, and during COVID especially, who are basically couch surfing. So where do they go for that anchor or that structure? And I can't, I feel like my resources are limited. I feel like you are one of my resources.
I think that's a really great way of framing it, because we do know that when families have that inconsistency, the ability for a childcare provider to support in that and to be able to connect, I think to look at, we know about some of the systems, WIC or SNAP or pieces like that, but I think sometimes viewing yourself as one of those crucial elements can really change the approach or the factor for that.
Definitely wanted to echo that. And then also just kind of a concrete example of what a powerful advocate you can be if you do encounter a family who is experiencing the challenges of homelessness or just unstable housing, and they have infants, and maybe they haven't had time enough to get a pack and play from one of the resources that we said. Some of you may already know this, but just an empty laundry basket with nothing else in it but the baby in their sleep sack placed on their back can be a safe sleep environment in a small setting, where they're perhaps staying with a relative and there's frankly not enough room for a pack and play. So just reiterating all of these healthy recommendations to keep these babies and young children safe.
And I think one of the things pediatricians do, especially with mothers of infants, is maternal depression screening. Depression is extremely high in families that are homeless, and there are some resources to help with those concerns.
Excellent. Well, as we get into our last few minutes here, we're going to hit on the last series of questions that we had, which were all around this idea of partnerships and what can it look like and how can we strengthen some of the partnerships. So there are 3 questions I want to make sure we get to. And the first is one that I know are on several providers' minds. During COVID, we are noticing a delay in getting paperwork to start children in care. When it comes to physicals, well child checks, what are pediatricians seeing and how can we work together to address the issue? How can a pediatrician partner support our child care without disrupting what the medical practice is going through? So really around that idea of how can we work together to get the paperwork done in order for children to start in care in a timely manner?
This is Emily. I can get us started. So I think that you are all aware that like many of your centers, while some of them were able to stay open, many medical practices were either closed or had limited access for several months. And so some of the well child visits continued virtually during that time, and some well visits got delayed. And we are getting caught up on those, but some of the paperwork may be because the visit hasn't actually happened or is coming up because of those closures or delays. But although we saw a dip in those checkups and immunizations, we want to be seeing those kids. And so we do want you to be encouraging them to come in for that care because we know it's important for keeping them healthy. Just the logistical aspect of getting it is always challenging, but if you can have the family sign a release to fax along with your request for that paperwork, that will help us because we can't release it to you without the written consent from the parent. Sometimes filling out an additional form is challenging, so if you can accept a visit summary or a copy of the note, that might help expedite getting it back because it won't require us to fill out an additional form from what we're already doing. And many health systems now offer a patient portal, which is an online way that they can view some of their records. And so you may encourage the family to see if they have access to kind of proof of those well child visits or immunizations through their portal as another way to get that information to you as an alternate to your normal ways of obtaining it.
Excellent suggestions. I know that that is something that is on the mind of providers because it is one of those. And also I would remind everybody to look at the timeline that you have to turn in those pieces. So if you do have a 30-day window, sooner is better, and getting those asked out to the pediatricians, but also knowing that you can work that window if you do need to. Excellent. And a note that came in too is that state licensing will accept a printout from the electronic medical record. So keeping that in mind too. Really, I think the biggest piece is just working together as easily as possible and understanding the situation so that we are able to get children into care.
And to have the parents fill out the majority of the form. Most of it doesn't require a physician, right? So if they bring the form with them and their name and their birth date and their address and all that stuff's already on there, there's a lot that they can fill in. What the child's eating, the parent tells us. So for us then to write it, if they could go ahead and do that, we can discuss it and make changes if needed, but have it already done is a huge help.
Mm-hmm. I'm going to share out a resource that's on screen right now that is an answer to several questions that came in that all related to obtaining the most prevalent information on current illnesses and diseases to share with parents and staff. And this resource, which is on the slide, the Managing Infectious Disease, was suggested by, I think, unanimously everybody as something that can be looked at and can be used when you're looking at sharing information out. So I want to put a plug for it there. And then want to go ahead and skip to our last question here, which came about in several ways.
I just mentioned that Indiana AAP is donating a book. And I think what we'll do is give it to Early Learning Indiana, and you guys can decide whether you want to have a raffle or how you want to give that book to somebody.
Ooh, excellent. I love free books, especially ones that go out, and I love free books that have to do directly with the content that we're doing. So that is really exciting. We will find a way and we will get that book out. Thank you. This is why you have to make friends with your pediatricians, not just because they give you things, but because they can help with a lot of the questions and a lot of the services or pieces that you're looking to do. So our last question that came in is actually one of the ways you can do it is answered here on the screen. And that was about how providers can build relationships with local pediatricians. So as part of this 3-part webinar series, we are looking to encourage and invite you as early learning providers to be connected. So the Indiana chapter of the American Academy of Pediatrics is going to make connections as possible between our early learning providers and our pediatricians that are local to them. So there's a link on there. That link is going to be shared out. We will be emailing all of our participants and all of our registrants from this webinar to share that probably later tomorrow with the additional resources as well. But you can sign up, do the quick survey there, and then look to be connected. Then you'd be able to continue the conversation with those who are in your community about how you could specifically partner, what you could look to do together, and all of the questions that you're not able to get answered in our 1-hour session, you could potentially look to answer and engage with a local representative who can help to do that. Also want to point out that Nancy Ward from the Office of Early Childhood and Out of School Learning is going to be presenting a webinar, also sponsored by the Indiana AAP. That's a lunch and learn for partnerships and looking at helping make sure that our pediatricians know that they can also have these types of connections and those types of pieces. So we definitely encourage all of you to sign up, to fill that out, and to look to get connected to a pediatrician who can help you continue the conversation that we've begun today. This is just the beginning of what we're looking to do and how we're looking to engage. I know that we are right at our time, so what I would like to do is just issue out a big thank you to Dr. Shearer, Dr. Sweck, and Dr. Swagonski for gifting us with your time today and your expertise and the amazing resources that you shared. I'd also like to definitely say thank you to all of our providers who were able to join us, and thank you to our families and our children who are trusting us, both of us, all of us, to care for their children and to be a piece of their story. It is a huge responsibility, but it's one that I will say I see every day early learning providers and pediatricians across the state of the Indiana stepping up and saying, I'm here, I'm ready, and we want to support your families and your children. So thank you, Dr. Shearer. Thank you, Dr. Sweck. Thank you, Dr. Swagonski.
Thank you.
Thank
And
you.
yes, and if you have not already registered for our session 2 and our session 3, many of the questions that we were not able to get to today that relate to that physical health and mental health will be addressed on those. So we hope to see many of you back and asking questions on those topics as we return. So with that, I will wish everybody a happy rest of your Tuesday and have a great day.
Bye-bye.